Have you ever experienced a sudden, sharp spike of pain deep inside your ear? Or maybe it's a dull, relentless pressure that feels like an infection brewing? You do the responsible thing. You go to your doctor. They take out the otoscope, look deep inside your ear canal, and give you the most frustrating news possible. Your ears are perfectly clean. There is no infection. You leave confused, maybe even feeling a bit crazy, because the pain is real. But here is what is actually happening. You are the victim of a biological phantom signal. That pain isn't originating in your ear at all. It is a referred pain traveling along the glossopharyngeal nerve, your ninth cranial nerve. This nerve is like a busy highway that connects the back of your throat directly to your ear. When something irritates the deep tissues of your throat, your brain misinterprets the distress signal and tells you the problem is in your ear. So, what is triggering that nerve? It is a silent, growing construction project hidden in the dark recesses of your tonsils. You might know them as tonsil stones. But we need to shatter a massive misconception right now. Most people, and even some general practitioners, will tell you these are just harmless bits of leftover food or debris stuck in a pocket. That is a dangerous oversimplification. Science defines these structures as calcified biofilms. These are not passive lumps of debris, they are active, living cities of anaerobic bacteria. And this is where the story shifts from annoying bad breath to a serious health warning. If you have that metallic taste in your mouth, or that distinct rotten egg breath even after brushing, that is the smell of sulfur compounds being released by a specific type of bacteria called Fusobacterium nucleatum. This isn't just a mouth problem. This is a cardiovascular risk. Research has confirmed that these specific pathogens are not content to stay in your throat. They generate systemic inflammation that travels. Studies link the bacterial load in these stones to vascular stress and atherosclerosis. Your body is generating this phantom ear pain as a warning shot. It's telling you that your immune system is fighting a losing battle against a fortified enemy that is trying to turn your throat into a toxic reservoir. So, if this isn't just old food, what exactly is the biological villain hijacking your throat? To understand this, we have to look at the microscopic architecture of your tonsils. You probably imagine your tonsils are smooth pink mounds, but if we were to zoom in with a high-powered camera, we would see something that looks less like a smooth hill and more like a deep, dark, scarred cave system. These are called crypts, and as we age, they become what we call fibrotic caverns. These deep pockets are hypoxic, meaning they are starved of oxygen. This oxygen-deprived environment is the perfect breeding ground for our villain, anaerobic bacteria. When these bacteria float around in your saliva, they are harmless. But once they drift into these dark, airless caves, they flip a biological switch. They stop floating and start building. They undergo a phenotype change, transitioning from free-floating drifters to a stationary colony. They begin to secrete a sticky, protective glue called EPS. This is the start of a biofilm. Think of it like a coral reef. Just as soft coral polyps build a hard limestone skeleton to protect themselves from the ocean currents, these bacteria build a hard shell to protect themselves from your immune system. Here is where the chemistry gets fascinating and dangerous. This process is called dystrophic calcification. Your saliva is naturally rich in calcium, which is good for your teeth. But inside these infected crypts, the bacteria are feasting on proteins and lowering the pH balance from a healthy neutral 7.3 down to a highly acidic 5.8. When that calcium-rich saliva flows over this acidic bacterial city, a chemical reaction triggers instantly. The calcium precipitates out of the liquid and solidifies into calcium carbonate. Literally, the soft slime turns into hard rock. You are not growing stones, you are growing a biological fortress. And inside that fortress, it is a chemical weapons factory. Safely encased behind that stone wall, the bacteria at the core ferment sulfur-containing proteins. This releases volatile sulfur compounds, specifically hydrogen sulfide, which smells like rotten eggs, and methyl mercaptan, which smells like rotting cabbage. That is why you can taste metal. That is why the breath smell is so distinct and potent. It is gas leaking from a pressurized stone container. Most people try to fight this villain with mechanical tools, cotton swabs, water picks, or fingers. But that is like trying to remove a coral reef with a toothpick. You might break off a piece, but the living base remains, and it will just grow back. To truly defeat this villain, we don't need a physical weapon, we need a chemical hero. We need something that can reverse that calcification process, dissolve the mortar holding the wall together, and turn that hard rock back into liquid so your body can naturally flush it away. So, how do we dismantle a biological fortress without destroying the delicate landscape of your throat? I need you to listen very closely, because the natural instinct here is almost always wrong. When you see a stone, your instinct is to dig. You grab a cotton swab, a toothbrush, or worst of all, your finger, and you start poking. Stop immediately. Every time you push against your tonsils, you are risking what doctors call traumatic cryptolysis. You are creating micro tears in the tissue, and you are often pushing the bacteria deeper into the bloodstream, which can trigger that systemic inflammation we talked about earlier. We are not going to excavate these stones. We are going to dissolve them and flush them out using a protocol I call chemical disruption and hydraulic physics. Step 1 is the chemical dissolve. We have to acknowledge that these aren't just stuck food. They are calcified stones made of calcium carbonate. If you have ever seen what happens when you pour vinegar on baking soda, you know that acid breaks down calcium. Your tool here is raw, unfiltered apple cider vinegar, but you must use it correctly. We are not drinking it straight. You are going to mix 1 tablespoon of ACV into a cup of warm water. This creates a mild acetic acid solution. When you gargle with this, and I mean really gargle, getting it deep into the back of the throat, you are bathing those stones in a solvent. The acid begins to react with the calcium shell, softening the stone's outer armor, but biologically it does something even more critical. It dissolves the EPS matrix, that sticky, glue-like biofilm that binds the bacteria together. Think of this as melting the mortar between the bricks. You aren't forcing the wall down, you are chemically dismantling it so it crumbles on its own. Once the structure is weakened, we move to step 2, the hydroflush. This is where we use physics to our advantage. Now, a major warning here: do not use a standard electric water flosser. Those devices are designed to blast plaque off tooth enamel at high pressure. If you aim that jet at your soft, infected tonsil tissue, you can slice the skin and inject that toxic bacterial load directly into your neck tissue. Instead, you need a specific tool called a Monoject 412 syringe. It costs a couple of dollars, it has a curved plastic tip, and it has no needle. You fill this syringe with warm saline water, locate the opening of the tonsil crypt, and place the tip near the entrance, not jammed inside it. Then, you gently press the plunger. You are creating a low-pressure, high-volume wave of water. Because the vinegar has already loosened the debris, this gentle hydraulic pressure is enough to lift the stones out of their caves and wash them away safely. It is a rinse, not a blast. Finally, step 3 is the most overlooked step: source control. You can flush stones all day, but if you don't stop the migration of bacteria, they will be back in 2 weeks. The primary breeding ground for these anaerobic bacteria is not actually the tonsils, it is the back of your tongue. The surface of your tongue is like a thick, shaggy carpet. It traps food particles and creates a low-oxygen environment where these sulfur-producing bacteria thrive. Gravity naturally pulls this bacterial sludge down your throat and deposits it right into your tonsil crypts. To stop this, you need a stainless steel tongue scraper, not a plastic one, which can harbor bacteria, but stainless steel. Every single morning before you brush, scrape from the very back of your tongue forward. You will likely see a thick white or yellowish slime come off. That slime is the raw material for your future tonsil stones. By physically removing it, you are cutting off the enemy's supply line and starving the tonsils of the bacteria they need to rebuild their fortress. Now, I want to address the final and perhaps the most dangerous myth surrounding this condition. If you have been suffering from this for years, dealing with the embarrassing breath, the discomfort, and that maddening ear pain, you have probably been told by a doctor or a well-meaning friend that there is only one permanent solution: surgery. They tell you just get your tonsils taken out and the problem is gone. I need you to pause and look at the reality of that advice. While tonsillectomy is a common procedure for children, for an adult, it is a significant, brutal surgery. The recovery period is often 2 to 3 weeks of excruciating pain, with risks of severe bleeding and infection. It is the nuclear option. And for the vast majority of people watching this video, it is completely unnecessary. The myth here is the idea that your tonsils are defective. They aren't defective. They are doing exactly what they were designed to do. They are immune system traps, filters meant to catch bacteria before it enters your lungs. The problem isn't the filter itself. The problem is that the filter is clogged because we stopped cleaning it. Think about it this way. If your teeth had a buildup of plaque and tartar, would your dentist suggest ripping out your teeth? Of course not. They would teach you how to brush and floss better. They would give you a hygiene protocol. Yet with tonsils, we treat the organ as disposable rather than treatable. Now that you understand the science of biofilms, the chemistry of pH balance, and the mechanics of the crypts, you have the power to treat the organ. You don't need a scalpel, you need a protocol. I want you to visualize what happens when you commit to this protocol for just 30 to 60 days. This isn't just about hygiene. It is about reclaiming your confidence and your systemic health. Imagine waking up in the morning without that heavy, sticky feeling in the back of your throat. That metallic taste that ruins your morning coffee, it's gone. But the most profound change will be the silence. That sharp, stabbing phantom pain in your ear, the one that made you think you had an infection, will simply vanish. Why? Because you have decompressed the area. You have removed the physical pressure that was irritating the glossopharyngeal nerve. You have stopped the false alarm. But let's look deeper at the invisible victory you are winning inside your body. By clearing out these living stones, you are removing a chronic source of infection. You are evicting colonies of Fusobacterium nucleatum that were leaking inflammatory markers into your bloodstream every single day. You are no longer forcing your immune system to fight a war on two fronts. You might notice your energy levels stabilizing, your skin clearing up, or even your blood pressure improving, because you have lowered the total inflammatory load on your cardiovascular system. You turned a localized annoyance into a systemic health win. You listened to the phantom signal, and instead of ignoring it or drugging it, you decoded it. This journey from confusion to control is why I do what I do. But I know how isolating this specific symptom can be. It makes you feel paranoid when doctors tell you nothing is wrong. So, I want to ask you a specific question, and I want you to answer it in the comments below. Have you ever experienced that sharp, unexplained ear pain, gone to a doctor, and been looked at like you were crazy when they found nothing? Tell me your story. Let's build a database of experiences right here in the comments to validate what thousands of people are feeling but are too afraid to talk about. You are not imagining it, and now you know exactly how to fix it. Thanks for watching, and I'll see you in the next one.